Welcome. I hope you took the chance to read a few of the testimonials of chronic knee patients that responded so well to traditional Chinese medicine. I've seen incredible results with my patients for everything from chronic lung, kidney, and liver disease to almost any type of musculoskeletal condition that you can imagine. But I particularly like working with knees, though, because of the high rate of success that we've experienced, especially when combined with chiropractic and the energy modalities that we use in our office. Now, if you have a severely degenerated knee or knees, you might want to consider using these modalities in conjunction with traditional Chinese medicine, as this will not only speed up the healing of the joints, but give you the quicker relief from the pain and shorten the healing time required. First, let's talk about how we determine the necessary length of treatment that I'm going to recommend. This comes from looking at the x-rays or the MRIs. Now, although we can initiate treatment without having them to look at, we won't be able to determine the extent of damage, making your symptoms the only measuring marker that we can go by. So therefore, if you have any recent x-rays, MRIs, or even just a written report, please bring that with you on your first visit when you come to see me. Now, if you've never had any studies performed on your knees or knee, we can request those for you. Most insurances will pay for these. However, I have a special setup with a local imaging center for those who have either high deductibles or just prefer to handle things with cash. Cash rates for x-rays run between $50 and $65, and the MRIs, which helps us to visualize the cartilage and soft tissue rather than just the bone, cost $450. MRIs also help us to identify tumors or other unusual things that could be causing your knee pain. Now, if you have knee pain that's only been bothering you for a few weeks or months, we may just need to reset the joint with an adjustment. If that's all it takes, 1 or 2 treatments will usually do the trick, and the cost for that's only $75 per treatment. Now, we might even throw in a couple of healing patches that run between $30 and $60 each to repair any soft tissue damage. But the real secret to our 95% success rate with knee problems is understanding why the joints developed the problem in the first place. Most people with knee problems never had a traumatic injury and believe their arthritis is simply the normal process of aging. Now, if that were the case, everyone would have knee problems as they grew old, but that's just not the case. Is the patient grossly overweight and deconditioned? How is their digestion? You see, if you're not making sufficient stomach acid, you can't absorb your minerals, such as calcium, and you need those minerals to balance out the acidity of the body. And if you either don't get enough or you can't absorb them, your body will leach these minerals from your bones and from your teeth. Then during the night, when you're not going to the bathroom to excrete the excess minerals that you've pulled out of those bones into your urine, your body will lay down the excess minerals in areas of stress or inflammation. And the knees are a prime site for this to happen, especially if you have old injuries or suffer from obesity. This is occurring especially when we see bone spurs on the x-rays or MRIs. So if you fall into this category, I'll have to get your stomach working properly or add acid and minerals into your diet. In fact, I'll teach you how to monitor yourself to tell if you're getting sufficient mineral absorption. Now, if you know that you have rheumatoid arthritis, we'll also have to address the gut because you'll likely need to have your gut lining repaired. With autoimmune disease, the gut is usually involved whether you have digestive problems or not. If you're unsure if it's a rheumatoid arthritis but have swelling in other joints such as your hands or your feet, we might want to do some lab work and check to see if you test positive. This is important because we can't reverse the joint damage if your immune system continues to attack the cartilage. Depending on the type of damage, inflammation, or disease process you have in your knee will determine what type of treatment we can use. So let me share a little bit about the different types of modalities we have and what they're used for. If you suffer from bursitis, degenerative arthritis, rheumatoid arthritis, meniscus, or ligament tears, one of the treatment modalities that we use is cold laser therapy. Cold laser therapy is an FDA-approved treatment that's unique in its ability to penetrate through the bone, soft tissue, and muscle to deliver healing light energy to the cells of the body. It can reduce pain, minimize swelling, soften scar tissue, and reset the pain cycle, all while healing damaged tissue at the cellular level. One of our patients' favorite modalities is the PEMF, which stands for Pulsed Electromagnetic Frequencies. You may have heard about this therapy on Dr. Oz. That PEMF modality that we use was designed by the research engineer at NASA. he increased the power of a small handheld unit to that of a much larger $60,000 unit, and it fires pulsed electromagnetic waves deep into the tissue, which has a pain-reducing, anti-inflammatory, and tissue-regenerating effect. Now, one of the studies at NASA was with a dissected portion of a tibial bone in a rabbit's leg. Now, without the PEMF treatment, the bone, of course, didn't regenerate and grow back. But with only 28 days of PEMF treatment, the bone completely regenerated and refused. The same study was repeated successfully 10 times. Now, I know you might be thinking, okay, that's great. My tibial bone is just fine, thank you very much. Well, that study just demonstrates what happens when you stimulate stem cells to grow. Now look at this next clinical study, focusing on the cartilage of an osteoarthritic knee. In the before picture, you can see the x-rays of this 60-year-old female. Her knee cartilage had degenerated nearly to bone on bone to a point that it was just too painful for her to walk. After 4 months of PEMF treatments, you can clearly see how the cartilage has repaired and regrew to the point that she could actually walk again. Another energy modality that we sometimes use for moderate to severe pain and swelling is the HackleMed. Now, there are clinics across Los Angeles and other major cities that utilize this therapy as their main form of treatment for pain, edema, peripheral neuropathy, and the regeneration of damaged nerves. Now, most electric stimulation devices fire at a frequency between 0 and 100 hertz. That means that they electrically vibrate the tissues between 0 and 100 cycles per second. Now, putting different frequencies into the body can have different effects. At certain frequencies, we can cause vasoconstriction, which reduces swelling, similar to icing the area. At another frequency, we can induce vasodilation, or the opening of blood vessels to reduce edema and enhance circulation. Now, research has shown that if you can expose a nerve to frequencies above 1,000 or above its normal firing pattern, you get a biochemical reaction rather than just a mechanical one. The mechanical reaction is what you get with normal electric modalities below 100 hertz, where you just get a vibration of the nerves and the muscle contractions. Now, with the HackleMed, we can produce frequencies of up to 20,000 hertz. And believe me, that's impressive. But the really cool feature of the HackleMed is that it allows us to cycle between frequencies, which allows us to provide the patients with a wide range of different frequencies. Now, what this means is that we can use this technology to increase the membrane permeability, to increase the sodium-potassium influx, and heal the nerve. Or we can use it to relax muscles or even help bone and cartilage to heal, even promoting increased bone density with osteoporosis. And of course, we have the normal electrical stimulation devices that you might be more familiar with. Those include TENS units, EMS or electric muscle stimulation therapy, and even peripheral nerve stimulation, which fires at the same hertz frequency as your nerves do. These are much less expensive but still effective in pain management. Another popular modality we use is the Rife technology. This machine carries frequencies into the body with a photon energy beam produced by a Tesla bulb. Now, depending on the frequencies that we program it for, we can reduce swelling, decrease pain, shrink tumors, and destroy cancer cells, kill off bacteria, viruses, parasites, and other microbes. Now, many times we use this technology to speed up the healing of damaged joints. Many times we're relieving the pain in just a couple of treatments. Now, below this video is a paper written by one of my colleagues, Dr. Kevin Connors. Dr. Connors uses the same Rife machines that we use in our office to help his patients recover from cancer, Lyme disease, and other chronic conditions. He gives a great explanation of the science behind this technology as well as its history. So if you'd like to learn more about the Rife machine and its inventor, Royal Rife, Dr. Connors' paper will help you to better understand it. Now, as exciting and powerful as the Rife machine and these other modalities are, we have another modality called a biocharger. That combines 3 of these energy type treatments to produce a super potent energy field. In fact, this is the most powerful energy modality used for accelerating healing known today. It actually increases the voltage in the cells, supercharging the body and its healing capabilities. Now, if you don't know much about energy treatment, this might sound like a foreign language, but energy medicine is very likely the medicine of the future. It restores the normal energy levels to all the cells of the body, which enables the body's own healing capabilities to perform the way that they're supposed to. Yes, your body and joints are supposed to heal and recover from injuries and disease, not just continue to degenerate. If your medical doctor has told you that it's impossible to reverse degenerated cartilage, I'd make mention of the book by Dr. Russ Schroeder that cites hundreds of studies that show this to be untrue. Depending on your condition, you may need in-office treatments using some of these modalities, but we have packaged programs that will offer these different treatments that range from about $1,400 to $1,700 a month. Now, if you need 3 or more months of treatments, we have further discounts to help keep the costs down. And you can always choose to just try one or more of the treatment modalities, and we can go over the individual prices that you might be interested in. Now, regardless of the use of modalities, we'll want to use some traditional Chinese medicine to accelerate your healing. Now, in many cases, this is sufficient treatment alone, but when you combine it with the modality treatments, of course, you're going to see faster results. The cost of these products run about $600 to $900 per month, or $900 to $1,200 for both knees. But again, depending on your condition, you may need as little as a week, or up to 6 to 9 months for the most challenging or severe cases. But you'll start to feel improvement in the first month of care, and you can always decide to stop treatment at any time. If we decrease your pain enough in the first month, let's say, and you're satisfied with those results, you don't have to continue treating to get full recovery of the joints. But the first thing we need to do is sit down and talk. If you already have films, I can take a look at those, or we can discuss ordering some if you don't. I even have patients that just want to proceed with care, without doing any films. And as long as you progress as anticipated, that won't be necessary. But if we don't see the results that we expect, that's when we need to get them done so we know what we're dealing with. Normally, our consultation and exam runs $295, but we're running a special on this knee consult examination for only $49. So if you want to get your knee problem resolved, or even just want to get enough treatment to cut the pain in half, you'll never have a better opportunity than this. And as a special incentive, for the next 10 patients that sign up for any modality program for a month or more, they'll receive an additional $100 discount. So don't wait. Schedule your $49 consultation today. Well, thanks for taking the time to watch this, and I hope to see you soon. God bless.